Hi, welcome to Viewpoint. I'm Lily Newman, the host, and along with my co-host, Susan Solomon, the Executive Director of Drug Crisis in Our Backyard. Today, Susan is our guest, along with Nelda Neves, and we're going to be talking about the Family Support Navigator Program. Thank you.
Thank you very much.
Thank you. Could you just tell us what is the Family Support Navigator Program?
Okay.
Susan?
Okay, so the Family Support Navigator Program, it kind of has a long name, but it's exactly what the name suggests. It's a program to help families navigate the addiction maze. So it is about substance use disorder, okay? So it is helping families in many, many different ways.
Can you give us an example? Or Nelda, an example?
Okay, I'll give you an example. Let's say your family comes up against a crisis. Someone in their family needs help with alcohol or drugs. And we help them navigate the system to get help, to get them into treatment. It could be an outpatient program, it could be mental health, it could be a therapist, it could be inpatient, detox, rehab, sober homes, residential programs, and so forth.
So it doesn't always have to just be treatment, though, right? I mean, people can call for any reason.
Okay, so let me give you the big picture on this. Okay, so the Family Support Navigator Program was started by Oasis because it became very clear that families needed to be involved with their family member that was struggling with addiction in order for the family member to get better.
Okay.
Like the family couldn't not know anything about this and expect their loved one to get better either through treatment or through AA or in some way get better and then come back to a family that still didn't understand the process.
Got it.
So Oasis, which is the New York State Office of Alcohol and Substance Abuse, came out with a grant for this program, the Family Support Navigator Program. And the purpose of it is to educate families on what addiction is.
Got it.
And so it's really specific to substance use disorder, although there may be people that come to us that are also dealing with a mental health issue because very often they do go together, substance use and mental health issues. So we will talk to people that also are having a number of different depression, anxiety. They might be, OCD or borderline, but our primary focus is substance use disorder, and it's really help for the families. Okay, so we help the person who is not, who is addicted, but
through the families.
But our goal is really to help the family.
Got it.
So that's how it's different than a lot of the other grants that have been put out there that to help people either get into treatment or get a medication-assisted treatment, because this one is geared towards family members.
Right. Because you said the families get left out. They don't understand this disease. They don't know what happened to their loved ones. They're faced with a whole myriad of problems because of the addiction. Person comes home, and parents and family members still don't know what's going on. So they can call up with anything, with just questions, or they can just vent, or
that's correct.
They just need to talk, right?
If anyone has any questions and they need assistance, they can call our number at 845-225-2700 with extension 245.
So I'd like to kind of give you an idea of, go back a little, go back in history to when my son was sick. And our family was angry. We were very, very angry. And we didn't know who to call, we didn't know who to turn to, and it was always the treatment facilities we would turn to. Okay?
Who else?
For a call.
And
so the problem with that is that may not be the best place for your loved one. That may not be the best facility for your loved one. But when you're calling a facility, they're going to try to get you to come to their facility because it's about the census and the numbers. How many beds are filled. So that was the experience we had. And then even when we did get people on the phone, Nilda, they were not nice to us. They were like condescending. And it was very embarrassing to make the calls besides. So not only were we not getting any emotional support. When we would get off a phone call with a treatment center, it would be like we were embarrassed.
Right.
And so my son didn't want to call either because he was embarrassed.
Right.
And there was a big, stigma associated with the disease of addiction, as we know.
I think it's gotten a little better now, but a family member can, from my understanding, if a family member calls up, excuse me, we have to speak to the person who wants to come into treatment. Yeah, but I'm a fan. I just want to ask a question. No, we have to speak to the person. They have to call, So I guess the Family Support Navigator Program really cuts through that for families. They'll
I don't know if that would change. Like, Nilda, you worked in that field for a long time, and did you find that what happened when family members called for their loved ones?
If their loved ones didn't sign a release of information, which is a HIPAA law,
Right.
Working in a hospital, that's something that's drilled into our heads that they're not allowed to have a family call and us give them information of any kind, whether they're there or not.
Right.
So this is different because we are helping the family and we're making like informal referral to agencies that we work with.
Got it.
So, we know where to call, who to call, and we know the people. So it's different than someone calling from outside.
So it also sounds like you're taking, using you for an example, Sue, you're taking that nervousness, that embarrassment, and you're making the first call. So let's say you call an agency and say, I have a family, this is what they're telling me, let me give them your number. Their name is Susan. Susan will call Joan.
Correct.
And so that when you call, you say Joan, she already knows to expect your call. So it's not like coming out of left field.
That's exactly what we do.
That's great.
Yeah, so as a matter of fact, I heard Nilda on the phone yesterday with someone saying that someone was going to be calling her to make arrangements for her loved one. And but the very, very important other part of this is for us, because we're so used to working with the person that's addicted, to switch our thinking and say our customer or our client is the family.
That's right.
Our client is not the person
That's
that is having the problem.
Right.
So our first person or people of concern are the family members. So like yesterday, I was on the phone with someone, and there's a lot of anxiety with this disease. Mothers especially just they can't focus on their jobs. They can't really do anything else because they're so paralyzed. Yeah, exactly. And so I was on the phone with a mother who was telling me her whole story. And, so I listened, and where are you now? Where are we up to now?
Right.
Because most people give you the history, like they'll go back 10 years.
That's right.
And so, but we do want to bring them forward and kind of help them to focus on the present, because not everything will repeat.
Right.
And she was calming down as I was on the phone with her. And so that's a really big part of it, is just trying to get them to calm down, to focus.
I know that because you tell us how people get in touch with you, and are there hours? Is there a phone number? How do people get in touch with you with the Family Support Navigator?
Okay, so
Nilda.
We have our designated phone line, which is through our agency, Cove Care, and it's 845-225-2700, and it's extension 245. And I want to tell you that in Spanish, in case someone is watching that needs help. It's 845-225-2700, extension 245. And we speak Spanish, and if it's someone that speaks Spanish, we will always get back to you immediately. How the hours, as far as the hours, we cover from 9 in the morning to 9 at night.
Well, we cover from about 9 in the morning till 8 or 9 at night, and every day, Monday, 7 days a week. So there's someone on who will respond to a call that comes in within an hour, really. We don't say that in our policies and procedures, but the Family Support Navigators know that they've got to call in every hour to see if there's a call.
And if it's after 8 p.m., we'll call them first thing 9 o'clock in the morning, so they're not going to be waiting, more than 24 hours now.
And then once we meet, so we meet with them, like I have an
Right.
appointment on Thursday with
Okay.
a family. Once we meet with them, we give them our personal cell.
Right.
So our work cell.
Got
so
it.
now we can, they can call us directly. And one of the really good parts about this is that we follow up with them.
Right. Right.
So if we are recommending something to them,
Right.
we're recommending, let's say, an Al-Anon
Got it.
meeting, okay, for Wednesday night
Right.
in Mayapack. We recommend that, and then if they don't show,
Right.
we follow up. And,
Right.
and I mean, if you don't go to those meetings, you won't know if they
Right.
show. So you just follow up and say, you know, well, how was the meeting? They'll say,
Right.
well, I didn't go.
Right.
How about trying next week
That's
then?
right. And that's what families need. They need to maybe someone help coach them
Correct.
to go to take care of themselves,
That's
because this
correct.
disease, you don't take care of yourself. All the energy, right, is put into that person who is suffering from the disease of addiction.
Right.
And they'll learn how to deal, with this person when they come back from treatment. It's not, they need to learn the disease and educate themselves. Al-Anon is a perfect place for them to start.
And that's what you talk about, because there's an education component.
That's correct.
There is an education component. So we have workshops that we're planning for 2019, addiction as a disease, roles in the family, because there are roles that people take on in the family unit when someone has addiction, when someone's addicted. And so we explain those roles, and people start to identify with the part they're playing in it. And so when the person comes back, people, the family members have to kind of recognize how they're part of this disease.
That's
and
right.
the first time I went to Al-Anon, Nilda, I said, I don't want to be here.
Right.
I don't have the problem.
Right.
And I had stopped for a long time.
Right.
And then I went back and I learned more and more about it. And I wind up going for 8 years.
Right.
And I'll tell you, when he died, I was so thankful that I had been going to
Right.
that program, because I made a lot of friends there. And now I still go, actually, because it's tools for life.
Right. That's right.
And lifelong friends,
Yeah,
That's right.
supportive friends.
right.
And I think what's so great about it is that how do I say it? It gives the family someone that they can lean on, that it's just for them. Because
Exactly.
when you're calling up and you focus so much on this other person, we get left out. The family members
Correct.
get left out. So this program is just that you can call, and they can keep calling you back.
Yes.
Yeah.
And just call back and just vent.
Yes.
And it's not always about treatment. Sometimes people just want to be heard.
That's
Right.
correct.
And they want to be validated that they're not crazy. And then there's nothing, they're seeing what they're seeing in
Exactly.
their
'Cause that's
home.
what people think, right?
That they scratch their head, they go, but wait a second, things are missing or things aren't right. And the person goes, I'm sorry, but you're wrong. It's you.
Right.
And you start to believe it with
Right.
this disease.
So what I really remember something so vividly. I would look in my wallet and say, I thought I had $20 in there.
Right.
And so you start to question your own judgment.
That's right.
And when it goes on long enough, it went on for 10 years with
Right.
my son.
Right.
When it goes on long enough, it really has an impact on your self-esteem.
Sure.
And it took years after he passed away for me to trust what I was seeing
Right.
again.
Right.
So
Very
that's
good point.
that's really, people don't even realize it's happening. It's such a slow process.
Right.
It's sort of like the addiction.
That's correct.
Right?
It's I think it's debilitating at times for some families, but having that support system, having someone that's been there, and this service, this program is free and confidential.
Right.
Which is great. Where do you get anything free?
Right.
It's very supportive for the families, and the fact that it's free and confidential, they're reaching out to us.
Right.
We're getting a lot of calls.
Yeah. And we just started. I mean, we
know.
got the grant
Yes.
in like May. Okay, so I was hired in June, and then Nilda was brought on in August.
And then I was brought on to work the nights
In September.
Right.
And
so our little team here.
Yeah, so now we're fully staffed, and we're starting to get calls, and it takes a long time,
It
you know.
does.
Even though, Actually, Drug Crisis wrote this grant with Cove Care.
Right.
That's how we got it. And Drug Crisis has been around for 6 years.
That's right.
So I get a lot of calls to
Right.
Drug Crisis. So it's good because even if they're not coming through Cove Care,
That's
they're
right.
still coming.
They're still coming.
But
That
they
just doesn't matter how.
hopefully, Nilda keeps saying the phone number, and people will call and know that this is available. It's free and confidential,
That's
and the more calls we get, the better,
Right.
because it means that we're helping people.
And I think what takes, well, first it's like a new business starting, and that's going to take time. And then people know Al-Anon, and they might know Families Anonymous groups,
Yes.
and they know your spotlight.
That's
Right.
correct.
But knowing anything else that's out there for families, it's just not ingrained in people's heads, because I'm in the field, and people go, huh, what's for families? Family Support Navigator Program, what's that? And tell them, okay, and they write it down. But I think at the time, they're not used to saying it. But that'll change if we just keep going on out there, because no one else is doing this.
Well,
on the
there's-
phone, no one else.
No, there's 18 programs in
Right,
New York State. So
right.
there's 18
Right.
programs that have been granted. But also, I'd like the audience to know that even if your loved one is not in treatment,
Right.
you can go for your own
Right. That's right.
therapy at a substance abuse clinic.
That's right.
And it's covered.
That's right.
So-
You're right. Thank you. That's a very good point.
Because people don't know that.
That's right, because the insurance will cover the significant other family member in treatment without that person being in treatment.
Right.
You're absolutely right.
That's fairly new.
Yep.
A fairly new regulation, but it's very good.
And people don't realize that
Right.
they can go without the person being in treatment.
Right.
But I guess it goes back to families saying, I don't have a problem, or they don't know how that kind of setting can help them, or it's intimidating.
It's
I
intimidating.
think it's intimidating as
And
well.
I think with this disease, you learn to take a back step. You put your needs on the back burner, and you don't realize that you have a right to have needs and wants, and that what you see is not what you see. Your $20 is missing.
Right.
It's missing, and it's hard.
Along with the jewelry.
Along with the jewelry and everything else, that it
Correct.
changes your thinking.
Right.
And I'm crazy.
Right.
You go like, well, maybe it's me. I'm tired.
Right.
I just put in the wrong spot.
I spent it and I don't remember what I spent it on.
Right, and you start doubting yourself.
That's right.
Right. So the other thing we do is Narcan training.
Yes.
And you know about that because
Yes.
you've done so many of them.
Yes.
So maybe you want to talk about that a little bit.
The Narcan, naloxone will reverse an overdose. And an overdose happens when your breathing is depressed from opiates, which is heroin, oxycodone, Percocets, hydrocodone. And then the naloxone, it's a nasal spray. And I do this all the time, because like an Afrin nasal spray, just push it up the nostril, and within 3 to 5 minutes, it will knock the opiates off the receptors and cap it from 30 to 90 minutes. And the person will hopefully restore their breathing. The problem is now with fentanyl, you only get 2 of the nasal sprays in a box, but hopefully you're calling 911, you're administering the Narcan. If you have to use the second dose, the first responders are on their way, and you save the person's life, because you get them breathing again. So
That's
they're
amazing.
life-saving. I had a woman call, and her daughter's using heroin. She's not ready for anything. And I said to her, do you have a Narcan kit? So she said no. I said, well, can I meet you? We don't live far from each other. Just let me meet you. You don't even have to talk to me. I'll give you the instructions. I'll hand it to you, and I'll walk away. Because I think she thought that if she agreed to meet me, I was going to maybe trap her
Right.
or make her talk about things. I said, no, I'll hand it to you and I'll walk away. I'll go. I just want you to have the Narcan kit. So I followed up with her a couple of times, but she's just not ready.
She wouldn't take the kit.
And she won't meet me. And I said, we could just, parking lot. I'll fling it to you. Don't even look in my direction. I'll leave it on the floor and drive away. Anything, just get the kit.
But this is easier now compared to the old method
Yeah.
of Narcan that used to be
When
the
I trained with
injection.
you, with the needle in
With
the orange.
needle, yes.
Right.
This is so much
easier.
easier and less intimidating
That's right.
for anyone
That's
to
right.
use. Very simple to use and
It's like
life-saving.
Right. That's
It's
it.
amazing, whoever came up with that.
Which doesn't want it, just doesn't, so I'll keep. But that's the first thing I know when people call and they tell me their loved one's using opiates or just got out of treatment. Can I give you a Narcan kit? Do you want a kit?
So when they get out of treatment, it's very dangerous.
It's very dangerous because they're reduced tolerance. They don't need as much as they did. Tolerance is when you need more and more to feel the same effects. So when they go someplace, get their system cleaned out, all the drugs are out of their system. And drugs, you know, it's very strange. You have a built-in forgetter. It automatically, you forget the misery, the pain, where it took you. You're like, oh, it's just wonderful. And then you'll go back out, you'll use sometimes the same amount, and you overdose and die from it because your body can't tolerate it.
And also, I understand that people that are released from prison have a very high rate of death, like within the first week.
That's right.
Very high,
They say
astronomical.
That's right. Most of them will come out, they'll use, and they'll overdose. If they don't die that time, they say I think it was in the first 6 to 8 weeks they get out. If they don't die the first time, when they use again, they will. They'll pass the second time from an overdose.
And also, I just recently heard that if someone overdoses, the chances of them overdosing again
That's right.
are very
That's
high.
higher. That's right. That's right.
Yeah, so it's not like they learned their lesson.
I know.
It isn't. The drugs really change the brain.
That's right.
And that is so important. That's what we tell parents.
That's right.
This is not a choice.
That's right.
Okay,
It's not.
your brain, your child's brain, your son's brain, your daughter's brain has been changed.
Right.
And in order for it to really come back, it's going to take a long time, like a
Take
year.
a long time. That's right.
With the opiates.
That's right.
If they've been using them for a
That's
while.
right. And also, I think parents should go to see Wait 21 on YouTube. That's Wait, W-A-I-T 21. Could you tell them if they're over there? Tell them Wait 21
Yes, Wait 21.
on YouTube. It's a great little video that tells you how your brain gets addicted.
Yeah, it's a great one. It's wait21.org
Right.
is the URL.
Right.
And then they go on and you can see the video and it's just great. I mean, it really explains it.
Everything.
We use it when we talk to kids.
Right.
When we
It's
go to
good.
high schools. Like I'm going to use it tomorrow. I'm
Good.
doing a presentation with kids. And we use it there, but it's so elementary. But it's not talking down
That's
to
right.
anyone. It's so elementary that it's good for anyone that
right.
doesn't know about
I
this
give
disease.
it for adults. When I do Narcan trainings and presentations, I use it and I always say, I know you're in the field, if you're training people in the field, but we need to understand how the addiction gets started and why it's so hard and why your clients are using and continue to use. I just had a conversation with someone, works in an emergency room, and they say they keep seeing the same people over and over again. And as a healthcare provider, you get frustrated with them. But this Wait 21, I mean, it should be seen all the time, gives you a little bit of an understanding, a lot of understanding
Yes,
about how
absolutely.
the brain gets addicted.
Well, it does say that, first of all, age of first use is
That's
a
right.
very high risk factor. So people that start using at 12, 13 years old, they have a much higher rate.
They'll become addicted.
They will become addicted.
right.
And also family
History.
family history. So,
That's
my family has deep roots
Right.
in addiction. And we didn't know that then.
I know.
But now it's out there.
That's
You
right.
know, it's out there. People need to know that if you have a family member
That's right.
that has an addiction, alcohol, it's usually
Right.
alcohol
That's right.
because they're older and they have an addiction problem, you need to tell your kids about
That's
that.
right. That's
And
exactly right.
Actually, we had an article on our Facebook page
Okay.
this week, last week. It was posted. Tips about if your family has a predisposition to addiction, tips that you could use, especially during the holidays,
Right.
to keep yourself in check.
Got
Let's
it.
put it like that.
Yeah, right. For the person who's drinking who has a problem.
Right, because once you cross the line, as
That's
they
it.
say, once you're a cucumber,
That's it, you're a cucumber. I
you
never
can't
heard
go back.
that. That's funny.
Or maybe once you're a pickle.
Pickle, you can't go back to being a cucumber.
That's exactly right.
You're right. You can't. And I don't think people talk about it as they do regular. Like, hi, how are you? How's the weather? And I remember something that Steve said, that when he talked about what happened with Justin, so many people came up to him and said, this is what's going on in my house, and this is what's going on in my house. And you must find that also. People talk to you, know you, and they start telling you.
Right.
And it's, right? I mean, it's all over.
Well, the thing about it is, and the strange thing about it is, so many families in America are dealing with it, but everyone wants to sweep it under the rug.
That's right.
That's the odd thing about it. Like 2 out of 3 families are dealing with
Right.
some kind of addiction,
Right.
substance use. But nobody really, it may not be addiction, maybe dependency,
Right.
but nobody wants to talk about it. It's not a topic that can be brought up. It's like really weird, because when you do bring it up,
Right.
there's always someone there that'll say, "Oh, I know exactly what you're dealing
Right.
with. My
Right.
father, you know, my mother, my uncle."
Right.
Right?
Or you get
Absolutely,
the-
absolutely. When they call, you know, they always talk to you and ask you, you know, have you been through this? Yes, I've been through it. Yes, I've had family members. Yes, I know what you're going through.
Right.
You know, I'm very compassionate. We have to be.
Right.
Because it's a tough situation
Right.
where they're going through in their lives.
Right. And you know what else? And then when you talk about when you talk about other families, there might be someone that goes, and you know what they're thinking. Thank God it's them and not me. Can't be my family.
Exactly.
Right.
And then you think yourself, you're a bad parent. Like, wait, what did I do? And I think that's something why there's such a great program, because it takes that sting out. That
Yeah.
they can talk to someone who's not going to go, oh, tisk, tisk, tisk.
Right,
You know,
exactly.
You just, that mother, you know, so.
Yep.
You know what? Do you believe that the time is up? That-
No.
Yes, it is.
Oh, my goodness.
We are almost out. I want to thank you for being here. Can you just give the number one more time, English and then in Spanish?
845-225-2700, extension 245.
845 area code 225-2700 extensión 245.
Thank you very much. And it
Thank
is
you for inviting us.
You want to tell us again what it is quickly?
Family Support Navigator Program.
There you go. Thank
Thank
you.
you. Have a
Thanks
great day.
very
Thank
much.
you. We'll just keep talking. I think I'll get it.
Yeah.